Okay, Dr. Dan Yachter, the chiropractor. It's great to be with you. And every week, what we do is we do this segment, news, views, and weekly updates. And we broadcast it on multiple platforms. So we're going to go ahead and get started. And really the purpose of this segment that we do at noontime every Wednesday is to update our audience, our Facebook audience and YouTube audience as well, on the most current health topics, the headlines that are out there, kind of keep you in tune with the healthcare landscape and what's being talked about out in the healthcare world. And I'm going to go ahead and jump into a bunch of different articles. And these articles can be found. They are posted in my private group, My Family, My Mission. So if you want to get access to these articles, they are there in the group. And I'm going to go ahead and jump in and start discussing the first of many, many posts that we have to discuss over the next 30 minutes. So the first one that I wanted to bring up is a very interesting one. And this goes to really the point of what's happening with RFK Jr. right now. He's launching with CDC and the National Institutes of Health and all of the different organizations, basically the Health and Human Services director. He is the director that underneath the Health and Human Services auspices, basically, if you have this umbrella organization that houses the CDC, the FDA, the NIH, all of the different organizations. And basically what he's doing is getting all of these different people involved with launching a full investigation as to why the autism rates have exploded over the last 30, 40 years. It's gone from 1 in 10,000 to now 1 in 30, depending upon the state. Some states are 1 in 20. California, if you throw in that state in there, it's like 1 in 12. And what this first article talks about, this was going all the way back to 2020, March of 2020. The CDC failed to produce the support to support its claims, because of course we continually hear this coming out of the CDC, or at least we have for years. The CDC fails to produce to support its claim that vaccines given during the first 6 months of life do not cause autism. And that's what really has been parroted for many, many years, that vaccines do not cause autism. Vaccines do not cause autism. Vaccines do not cause autism. Your childhood vaccines, there is no proof. They're completely safe and effective. And there were basically law firms that demanded that the CDC produce the evidence that that is true. And they could not. In a federal lawsuit filed by the nonprofit Informed Consent Action Network, the Center for Disease Control failed to produce the scientific studies that backed up its long declared assertion that vaccines given to babies in the first 6 months of life do not cause autism. So they could not prove that statement. And they still have not been able to prove that statement. The CDC cannot support its claim that vaccines do not cause autism. So that's important to know. And again, that's why RFK Jr., one of his first missions, objectives, is to figure out why there's been such an explosion in the autism rate. And just, for the CDC just to say over and over, hey, there's no proof, vaccines are completely safe and effective, it's really not satisfying the concerns out there and satisfying or giving the explanation or serving an explanation as to why there's been such an explosion in the autism rate, insane explosion in the numbers of autistic cases. So hopefully we get some answers. There's a full out investigation right now. Is it environmental toxins? Is it the vaccines? Is it the chemicals in our foods? Is it the EMF? Is it the ultrasounds that are sending too much radiation, or too much invasive type of technology that's going out babies, specifically when they're in the womb? Like, what is it? These are some of the things that have been thrown out there as to potential causes or combinations of these things. And thankfully, RFK Jr. is exploring and investigating. The next post that I have here in My Family, My Mission. And again, if you really want to get a hold of these articles, they are there. This is a good one, published April 9th, 2025, this past April. Flu vaccines linked to higher infections, says early research. Anybody out there considering getting a flu vaccine, you definitely want to hear about this one. The flu vaccine is recommended annually for all Americans 6 months and older per the CDC, the Centers for Disease Control and Prevention. But a new study from Cleveland Clinic suggests that it might not have the protective effects people expect. And again, the Cleveland Clinic, they are pro-vaccination. They're pro-flu shot. They're pro-COVID shot. They're a medical organization. And what happened is when they did their investigation, the conclusions came out as such. The study found that the influenza vaccination of working age adults was associated with a higher risk of influenza during the 2024-2025 respiratory viral season, suggesting that the vaccine has not been effective in preventing influenza this season or any season. So listen up. Whether you're pro or con flu vaccine, this is really important information. In an analysis adjusted for age, sex, clinical nursing job, and employment location, the risk of influenza was significantly higher for the vaccinated compared to the unvaccinated state, yielding a calculated vaccine effectiveness of negative effectiveness. So not to just weigh you down with too many numbers and p-values and stuff like that. But what the graph shows, again, published in My Family, My Mission, all these articles are published inside of my private group in Facebook, but it literally shows that as the days go on, post flu vaccine administration or getting the flu shot, your risk of incidence of getting the flu and having a severe case goes up significantly if you've been vaccinated. So among 53,402 employees, it's a lot of employees, 43,857 or 82.1% had received the influenza vaccine by the end of the study. Influenza occurred in 1,079 during the study. So 2%. The cumulative incidence of influenza was similar for the vaccinated and unvaccinated states early, but over the course of the study, the cumulative incidence of influenza increased more rapidly among the vaccinated than the unvaccinated. Effectiveness of this shot, again, shows that flu vaccine linked to higher infections, more likely to get the flu if you're vaccinated. How about that? Okay, so very important information, especially if you are a flu shot lover. Here's another one about the COVID shot. Expression of SARS-CoV-2 spike protein in cerebral arteries. And this article, this journal publication, implications for hemorrhagic stroke post-mRNA vaccination. And it talks about spike protein expression was detected in 43.8% of vaccinated patients, predominantly localized in the intima of cerebral arteries, the internal lining of the cerebral arteries, even up to 17 months post-vaccination. So again, there's a link, possible link of the spike protein put into the body, into the brain by way of vaccine causing stroke. Another article here. Very important to know, again, especially if you are pro-shot. Here's another one. This is from the Open VAERS. This is the vaccine adverse events reporting system, and where they've talked about how Harvard did a study showing only 1% of all adverse events are reported that should be reported. And even at that, 28,000, almost 29,000 reports of swelling of the heart, inflammation of the heart, almost 40,000 deaths due to the vaccine, 220,000 hospitalizations due to the vaccine. Basically, during the course of COVID, so over the last 5 years, 1.6 million reports of adverse events. So if only 1% is reported, my gosh, that's quite a bit. Was at 160, 16 million, 166 million reports of adverse events if it was actually reported properly. 156,000 cases of urgent care visits, 250,000 doctor office visits because of shot reactions to the COVID shot after getting it, almost 11,000 emergency-related anaphylactic reactions, and almost 18,000 facial paralysis cases, again, with only 1% of the cases reported. Very insane data right there. Crazy. Here's another one. The EPA, we're talking about fluoride in the water. Almost every single county, for the most part, in the state of Florida has removed fluoride from the drinking water. So close to 1 million people no longer have to be exposed or have their water drugged unknowingly or unwantingly. But the National Toxicology Program released a report in August 2024 concluding with moderate confidence that fluoride exposure above 1.5 milligrams per liter is associated with lower IQ in children. So the only counties that are fighting the removal of fluoride from the water, Dade County, Broward County, Metro Dade County, where they're, the remaining, outside of the million people approximately that have had it removed from their water supply, the other however many, million left, 3, 4, 5, Dade, Broward, and Metro Dade probably represents, 5 million people, however many million people. But those counties and others are the remaining populations that still have exposure to this horrible stuff that reduces your IQ when you have it in your water. So again, U.S. agency links high fluoride exposure to lower IQ in kids. It's directly from the Environmental Protection Agency. Get it out. This stuff should not be in our water supply, should have never been in our water supply. The EPA is committed to ongoing studies and continuing to make the public aware of how horrible this stuff is. Here's another article that I wanted to bring up. This has to do with the FDA approving the first blood test to detect Alzheimer's. So yeah, that's again, a lot of people would say, well, that's great, blood test to determine or detect Alzheimer's. Sure, I guess that could be a good thing, but the reason I bring this study up or this article up is the fact that all of these studies out there, or all the tests, including mammograms, prostate tests, pap smears, blood tests like this to detect Alzheimer's or to diagnose it. Sure, you could argue that that's a good thing, but you're basically finding the disease. You're finding it. Why wait to find it? And again, not that these are necessarily, bad things, but the focal point should always be preventing it. So this is all about detection, while what I teach at my master classes is all about trying to simply not get it in the first place. Right? That's the better strategy. But again, just to give you a little insight in terms of this, what this article's talking about, U.S. health officials on Friday, this past Friday, or 2 Fridays ago, endorsed the first blood test that helps or can help diagnose Alzheimer's and identify patients who may benefit from drugs that can modestly slow the memory-destroying disease. The test can aid doctors in determining whether a patient's memory problems are due to Alzheimer's or a number of other medical conditions that can cause cognitive difficulties. So that's fine if you want to detect it. But the problem is, once you have Alzheimer's, there's really very little that you can do. So they detect it. Now they say, hey, we got an experimental drug trial we could put you in, and we're not really sure what it can do. May slow it a little bit. But once you have it, you're in trouble. And really the better strategy, or the best strategy, is to do things daily, because when you're in your 30s, 20s, 30s, and 40s, if you show up in your 70s or 80s with Alzheimer's, it started growing in your 20s, 30s, and 40s, and maybe 50s. So you really want to start doing things now. The Alzheimer's, the Parkinson's, the cognitive diseases that show up in your late 60s, 70s, and 80s, they start growing 30 to 40 years prior to diagnosis. So again, I'm not really a big fan of these tests or these blood markers, because they don't really do much for you. You're already in serious cognitive decline by the time these blood markers can tell you anything. So that's it's something interesting on the horizon that we should know about. And another thing that they're looking at is many people are aware of this, beta amyloid plaques, tau plaques, neurofibril entanglements, where you end up with these plaques in the brain. And it's similar to the arteries. Just because you have plaquing in the arteries doesn't necessarily mean that you're going to have a heart attack, you're going to have a stroke, you're going to die from any of that stuff. In fact, a lot of people have plaquing, and it's a way that your body repairs damage in the arteries, but doesn't necessarily mean you're going to have a heart attack or stroke. Just because you have the presence of plaquing or these beta amyloid plaques in the brain doesn't mean that you're going to end up with a brain disease or Alzheimer's or Parkinson's or any type of the probably 100 different types of brain diseases. It doesn't mean it's going to happen. So, and that's another thing that they're using in testing to say, if you have these plaques, you have this genetic marker, and you have this blood value now that they have the test for, you're going to be, you're going to have a brain disease, or you're going to die of a brain disease, or you need this drug, or make any determination on a medical treatment. It's just not so. So anyway, that article is posted there. If you want to learn more about it, it's posted in my private group, My Family, My Mission. Here's another really great article to talk about. I want to discuss this. This is an article on Kefir, and I am a very strong proponent of getting what you need from food, making food your medicine. I'm also very into supplements, nutritional or nutraceuticals, nutritional supplements. But if you are going to do supplements, it's much better to get the majority of your nutrition and your nutrients from whole foods. Kefir being one of the best ways to get your probiotics. I do recommend many times for patients that they take probiotics in the form of a supplement, a capsule, but Kefir is a phenomenal way to get your probiotic needs. Probiotics are the commensal, the indigenous, the naturally occurring bacterial colonies, the microbiome that should be in the gut. All of this, when we talk about the microbiome and probiotics and the microflora, we're really referring to the colon, the large intestines. That's where this stuff is. And Kefir is teeming with probiotics. The bacteria that should be in the colon, or you really, you want healthy, healthy amounts of the stuff. The colon. Kefir may not be the first thing that comes to mind when looking to boost your immune system. Most people they reach for vitamin C and stuff like that. But Kefir is fermented dairy, and it's got hundreds of billions, if not trillions, of probiotics in them. Kefir may not be the first thing that comes to mind, but kefir is a powerful way to support immune function, often rivaling other probiotics' effectiveness, including supplements. Kefir is packed with probiotics and bioactive compounds that support digestion, reduce inflammation, and fight infections. So again, it's a fermented drink, and it's packed with probiotics, which help improve the balance of bacteria in the gut and boost your immune system. These beneficial bacteria help the body fight harmful bacteria and viruses more effectively. Probiotics also enhance immune cells, such as T cells, which are important in defending against infections. Kefir has natural antiviral and antibacterial properties that help prevent infections. Traditionally, fermented kefir has been suggested to develop a strong immune system. You could use it for kids. You can, small kids can drink it. Babies, you don't want to use a lot of it, especially if you have a deficient probiotic colony in your gut. You want to kind of take it slowly. But traditionally, fermented kefir has been suggested to develop a strong immune system. Introduced early on during an infection can help strengthen the body's defenses by supporting the immune system and gut microbiota. I call it the critter forest. You have these bacteria that make up your microbiome, and they are a major part of the immune system. Over 80% of all the immune tissue, including these bacterial colonies, exist in the gut that make up your immune system. It helps boost the immune system in the gut, which plays a key role in fighting infections before they fully manifest. In addition, probiotics in kefir can reduce inflammation, which is closely linked to immune system health, and help prevent or manage inflammation-related conditions like inflammatory bowel disease, Crohn's disease, things of that nature. Kefir also supports the production of short-chain fatty acids, such as butyrate, which is fuel that helps power the enterocytes of your gut. The enterocytes are the stomach cells that need fuel to work and do things like propel things through the GI tract, motility. Fatty acids nourish the cells in the gut, strengthen the gut lining, and reduce the risk of leaky gut syndrome, a condition linked to chronic inflammation and autoimmune diseases. You can further boost the production of IgA. IgA are these guards. Think of these like these sentry guards that line the entire lining of your gut from mouth to anus. And they nourish those cells. So IgA, the kefir, the probiotics in the kefir can boost the production of IgA. These are antibodies that improve the body's ability to detect and destroy pathogens. The result is a well-regulated immune function or immune system that is neither overactive, which can lead to autoimmune conditions, nor underactive, which leaves the body vulnerable to infections. So again, it's phenomenal. Kefir can contain 30 to 60 more strains of beneficial bacteria. No supplement out there that has that many strains of beneficial bacteria. So it is absolutely phenomenal. You can get locally, I get kefir. We usually pick it up at the Horstmeyer Farm and Garden, which is in Sanford on First Street, if you're familiar with the area. Keeley Farms out in New Smyrna Beach, they have it. Many local farms you can get it from. Fermented dairy, that is what kefir is. The bacteria in kefir, particularly strains like Lactobacillus and Bifidobacterium, promote the growth of beneficial bacteria in the gut, supporting the immune gut lining and enhancing the production of anti-inflammatory compounds. So, great article here on kefir. How much should you drink? For those new to fermented food, start with about 100 milliliters per day to allow the gut to adjust. If it's very imbalanced, it may be too much. You can get cramping, things like that. Gradually increase to 200 to 250 mLs per day for ongoing gut and immune support. So again, you got to start slowly and ramp your way up. Who can benefit most from kefir? As kefir supports gut health, a key pillar of overall well-being, almost everyone can benefit from it. However, certain groups may find kefir especially helpful. Those with a weakened immune system, recovering from illness, surgery, or dealing with frequent infections and chronic inflammatory gut conditions like irritable bowel syndrome, I mentioned earlier, inflammatory bowel disease. You really want to be careful with kefir that has added sugar in it as well. Milk allergies, lactose intolerant folks, people with a milk allergy or severe lactose intolerance should avoid milk kefir. Be very careful with that. Digestive sensitivities, very careful with slowly introducing kefir because you may have a lot of bloating and a lot of gas. And then histamine content. As a fermented food, kefir naturally contains histamines, which can be problematic for those with histamine intolerances. So you got to be very, very careful if that's you. So great article there. Hopefully what we brought you today will help. Again, if you want to grab hold of the specific articles and read them in more depth, then ask to be approved into our private Facebook group, My Family, My Mission. We'll get you access to these great articles, some great stuff there. And as always, I appreciate you joining me on our wellness journey here every Wednesday, 12 to 12:30, bringing you great information and all the news that's fit to print, all the major headlines on the healthcare horizon. Try to make sense of it here for you. And again, we try to stay ahead of the curve. We try to bring you this information, all the stuff that's coming out in the medical journal, the medical literature, what's really on the cutting edge in terms of the health knowledge, what's being published, not necessarily what's in the mainstream news, but what's in the research publications coming out. And don't forget, coming off what we were just talking about, kefir, probiotics, the gut, known as the second brain, direct communication with the brain-gut connection, that brain-gut access. That axis, you're going to learn the critical importance of keeping your gut healthy at my gut masterclass coming up June 17th, 2 weeks from yesterday. It's going to be Tuesday, June 17th, 6:30 p.m. right here in the office, Elevation Health Lake Mary. We want you here. You're going to learn so much about gut health, my achy, breaky, leaky gut. That is the title of that masterclass. And you're going to also learn about testing the gut that goes well beyond your typical endoscopy, colonoscopy, your Cologuard. There's very advanced gut testing that we use at the office that's not used in mainstream medicine, that is profound. It gives you profound insight and allows us to understand how to help folks who cannot get the GI help that they need through mainstream medicine. And again, I always say this, many gut issues are not thought of as gut issues. So when you think of bloating, gas, diarrhea, just cramping, things like that, cramping, most people think, oh, I got a gut issue. However, when it comes to things like headaches, depression, foggy brain, hormone conditions, hormonal imbalances, joint problems, so on and so forth, most people do not relate it to their gut. Breathing issues, high blood pressure, cardiovascular issues, they're not looking at the gut. Cognitive impairment, brain diseases, Alzheimer's. Most people don't think that my gut is involved with any of these things, but You know what? The science says that it is. There's a direct connection. Come learn, come grow, come get answers, and come elevate in your health knowledge. It's going to be a phenomenal masterclass. We want you here June 17th. Well, once again, I thank you for joining us for our news, views, and weekly updates. Dr. Dan Yachter signing off. We'll see you next week. Bye-bye.